Common orthopedic conditions. Common orthopedic conditions. So I'm going to talk about some very common orthopedic conditions. Not trauma, although there's sometimes some overlap. And this will be of value to medical students, residents, and junior doctors in their training to become a specialist. So here we go, a rapid review. Our friend is here to assist us, and his good mate Matilda. Carpal tunnel occurs in the wrist. It's where the median nerve, that's an important nerve, goes into the wrist here, you see. There's a band of tissue across it, carpal ligament. Pressure on that nerve causes numbness in the fingers, weakness of these muscles here in the thumb. If it doesn't respond to steroid treatments or splint, you may need to do an operation, just cut through that ligament. Stay on the older side of the nerve is very important because there's various branches, variant branches of the motor branch, the thenar muscles, the thumb muscles. Most of them come off on the other side, radial side of the nerve. Stay on the older side. So a little cut here, caution with the nerve underneath through a little incision. You can do it through endoscopic small incision, but it's full of risk, so just do it through a small incision. Trigger finger, that's where one or multiple fingers are locked down, you just can't get them out. Seems trivial, but it's not, it can be quite painful. Again here, see the tendons? They have to go through the tunnel, the tendon sheath. The train has to go through the tunnel. The entrance to the tunnel is too small, so you do a little cut here and open up the entrance. Just relieve the first pulley. Also ganglia, they're little cysts, they can occur here around the wrist, on the radial side, or here at the back of the wrist. So obviously when you're operating here, you have to take great care because the radial artery and nerve is nearby, so you don't damage them. On the back of the hand here, you have to take great branch. There's a radial sensory nerve. You don't nick it. Get a painful neuroma. Dupuytren's is another condition of the hand. It's an hereditary condition of the Vikings. See, the fingers are locked down. And that's due to contracture of the fibrous tissue just below the skin. So you have to do an incision here, making sure you don't make the skin avascular, and take out the contracted tissue just below the skin. It's between the skin and the tendon sheath, see? And you can straighten it out. Dupuytren's disease. Further up the arm, and now we're looking at the elbow. See, this is the ulnar nerve here, and it can be trapped or have pressure by a ligament here. It's called Cubital tunnel syndrome. And that's going to cause numbness over the ulnar side of the hand. When anti-inflammatories don't work, you may need to do an operation here, just release this tissue and bring the nerve forward. Not nearly as successful as you might expect actually, cubital tunnel, the surgical management. On the other side of the elbow, on the lateral, see you've got all the extensor muscles, and they go into one little area here, lateral epicondyle. Muscles keeps pulling, becomes very painful. Anti-inflammatories, steroid injections, an elbow band of some kind. Sometimes you may need to do an operation, remove the necrotic tendinous tissue here. Not that successful actually. Here's another condition around the elbows, more trauma though. Biceps tendon, sometimes it's ripped off the bone, deep down off the radius, and you have to reattach that to the radius. Going up to the shoulder, the most common condition here is rotator cuff. Now, when non-operative management doesn't work, including steroid injections, surgery really helps here. It takes away all the inflamed tissue, and you can repair the cuff with the great technologies available now. So, looking at Matilda here, here's the shoulder, humeral head. These muscles come off the scapula, wing bone at the back. From the top, supraspinatus, infraspinatus, along this border, teres minor. And they come under this arch, the acromion here, and they insert here. So you're doing your incision or cut from the side or the front. From the side or the front. You can bring them in the rupture and go back, bring them and reattach them, the bony anchor, back onto the humeral head. Take out all the inflamed tissue. It's a great operation, really helps the patient a lot. This technology's been developed over the last 10 to 15 years. Okay, now to lower extremity. Common conditions around the foot, Helix valgus. The toe's actually like this, bunion. The only way to really get it straightened out is to do a cut through the bone here. Redirect the bone, reshape the bone, redirect it. But the results aren't great. Sometimes there's a relapse. Now these toes here can sometimes be clawed like this. Patients hate the appearance. You can straighten them out like this. What you have to do is release the tendons here, or cut them, and fuse the PIP joint. Quite a good operation actually. Another common condition that people get worried about the feet, flat foot. See, the arch is gone. Now in children, they're usually flexible and very rarely operate on them. And adults can be quite painful. It's collapse of the midfoot, becomes flat. And you may need to do a complicated operation here. Bring the arch up and fuse or stiffen the joints of midfoot. Quite an undertaking, really. Back here at the heel, plantar fasciitis or painful heel. See the tendons or tissues on the sole of the foot. They put traction here, becomes very painful. Hard to treat, injections, insert into the shoe, operation not that great. So that's plantar fasciitis or painful heel. We're up to the knee now. Sorry I can't show you inside the knee, but it's usually the shock absorbers, meniscus lateral or medial. If they're torn, just trim them back. The main stabilizers inside the knee, anterior cruciate ligament, posterior cruciate ligament. They sort of go like this or backwards. Repair them, reconstruct them. It's quite a good operation. And then older age group, arthritis of the knee. It's very painful and stiff. The knee is bent. Do a knee replacement. Going up the thigh, sometimes a big quadriceps muscle here can rupture the middle part here. The middle part of the quadriceps can rupture across here. Big cork thigh or rupture down here coming off the patella. Part or all of the quadriceps can rupture, reattach at top of the patella. At the side of the hip, you can get trochanteric bursitis. Seems trivial, but it's not. It's a bursa here, inflamed. May need to inject it or excise that bursa. Deep down into the hip, of course, you can get a labrum around the cup, the detachment of the labrum, or of course, arthritis of the hip. And when nothing else works, a hip replacement. Great and very successful operation. Now we're going to cervical spine. The main thing cervical spine, of course, is these discs. See, a little bit of fibrocartilage between the vertebral bodies. With wear and tear or injury, they can become ruptured and put pressure on the nerves that are coming out here and go down the arm. Pressure on the nerves. So painful neck puts pressure on the nerves. Pressure on the nerves going down the arm is called radiculopathy. Here are the nerves coming from the neck going down the arm, behind the clavicle, down the arm. So you may need to take out part of that disc or fuse the disc spaces, and that will relieve the pain going down the arm as well as the pain in the neck. Now we're at the back, lumbar spine mainly. See the disc spaces again between the vertebral bodies. Again, they can rupture and go back. See, the nerves come out of this intervertebral frame in here and go down the leg. They can rupture and put pressure on those nerves. So you may need to take out a little bit of disc that's gone back and put the pressure on the nerve, or sometimes fuse it between vertebral body to lower vertebral body. Fuse that area. Lumbar spine, rupture of the discs, pain in the back, pain down the leg. The pain going down the leg is causes pain because there's pressure on this very important nerve. Do you recognize it? Yeah, it's a sciatic nerve. Nearly the same size as your little finger. Huge nerve when you're operating that region. So take great care with it. So that's called sciatica. Same as radiculopathy, but it's called sciatica. So I've given you a rapid overview of common orthopedic conditions or musculoskeletal conditions. And they have been in the upper limb, carpal tunnel, ganglion, trigger finger, trigger thumb, dupuytren's cubital tunnel, rotator cuff problems, tennis elbow. Lower limb, helix valgus, claw toes, flat feet. Around the knee, meniscal tears, ACL, PCL tears, osteoarthritis of the knee. Around the, getting close to the hip, cork thigh, hip OA, labral tears, trochanteric bursitis, then the neck and the back, of course, disc problems causing radiculopathy, sciatica. I hope this helps you. I hope you find it interesting. Keep up your good work in orthopedics.